Hi guys, it's Tammy McClish. Welcome to my basement on a snowy day. I just wanted to go over some of the techniques because I know a couple of you were asking questions about techniques. And so I want to do that with you today and hopefully it'll be helpful to you. Okay, so I know you guys know everything, but I just want to go over the basics. And these are things that you need to think about when you're taking the registry, okay? So first off, in the room, we have a transformer, and the transformer is plugged into the wall. And in that wall circuit, we have volts that are coming out. We have volts and we have amps. So we have volts and we have amps. Volts and amps are not enough to make an X-ray, or they're too much to take an X-ray. So for example, volts are not enough to take an X-ray. So there's a side of the transformer where we step up the volts to kilovolt peak because kilovolts are what we need in order to take an X-ray. So if you're driving down the expressway and you see a bunch of telephone poles, and then all of a sudden you see a silver box in one of those poles, that's a transformer. And that transformer is just like the transformers in our departments, and that's changing the incoming voltage that's coming from the power plant through the transformer into the businesses that are along the expressway. It's the same thing in our department. We're receiving voltage. Voltage is not enough. We have to step it up to kilovolts. So it goes through the step up side of our transformer, and then we are allowed to select kVp on our monitor. The other thing that's coming through from the wall is amps. Amps are way too much to take an X-ray. So we have another side of the transformer called the step down side of the transformer that is converting those amps into milliamps in order for us to utilize that in taking our X-rays. Now, when you sit down to take the registry, anytime you think kVp, I want you to think about the quality of the exposure. It will always be quality of the exposure. Now, what is the definition for kVp? The potential difference between X-ray tube, cathode, and anode. That is the definition. What does that mean? That's the quality of the beam. So for example, I think about it this way. It's not the speed of the beam, it's the penetration of the beam. So let's say that you were going to push somebody in the hallway. You just gave them a little nudge. That's low kVp. But if you gave them a little bit more force, that is high kVp. And the other way that I think about kVp is when I'm doing a mammogram and I'm x-raying a breast, I am going to need 25 kVp. The reason I need 25 kVp is I just have soft tissue, glandular tissue, fat. I have no bones. So it's not going to take much to penetrate that breast. So my kVp needs to be 25. Where if I'm x-raying a hand, oh, that's awful. Looks more like a mitten. If I'm x-raying a hand, then I want to go from 50 or any extremities whatsoever. I can go up to 69 kVp on any extremities. Now, when I'm thinking about extremities, I'm also thinking about the appendicular skeleton. So the appendicular skeleton would be your arms and your legs. I know those aren't very nice arms and legs, but appendicular skeleton is going to receive anywhere from 50 to 69 kVp. And that is because of the fact that we're only x-raying bone and soft tissue. So we're going to need a little bit more penetration of the beam because we have to go through that bone and soft tissue. Well, with a mammogram, we only needed 25 kVp because we don't have any bone in a breast. Now, when we get to the axial skeleton, which is going to be the skull and the spine, oh, that looks horrible. Then we can go 70 kVp or higher. So anytime that we are x-raying the axial part of the skeleton, which is the brain all the way down to the spinal cord, that is going to be, that's an awful marker, that's going to be 70 kVp or higher. Now, in saying that, the reason I picked 70 kVp is because anytime you x-ray a body part that is greater than 10 centimeters, you are going to need a grid. So I am going to institute a grid at 10 cm or higher, which means that I'm going to be using 70 kVp or higher. Now let's go back here. Breast, 25 kVp. It's just adipose tissue. It's just glandular tissue, a little bit of pectoralis muscle. Once we get to extremities, we've added bone. So we need to be between 50 and 69 kVp. Now, if we get to a knee or we get to a femur, then we can go up to 70 kVp because remember, those areas of the body are greater than 10 centimeters. So we have to institute a grid. Now, the reason that we also go to 70 kVp for the brain and spinal cord is because we also have organs in those areas. We have no organs in the extremities. Well, we have some organs, but we don't have kidneys and things like that. At least I hope not. So once we get to the point that we're instituting organs, we have to go to at least 70 kVp. And we can go all the way up to 120, 125 kVp. Now, here's the caveat. It's a big term. I don't know what it means. I don't know. Anyway, here's the reason we also do this. Anytime you think of kVp, I want you to think that kVp controls the contrast of your X-ray. Now, unfortunately, you probably have not seen this in doing digital imaging, but when we are performing film screen or sometimes with CR, not really, you can actually see that. And the reason we can't see it with digital is because digital has lookup tables and those lookup tables fix things. But I can also show you, and I'm going to do that in the future, I will show you what it looks like for contrast. So let's just think about contrast. So contrast is the degree and difference between lights and darks. So if I take a look at this marker here, and I put this marker back by my board, if I'm comparing the black part of the marker to the board, that is high contrast. So high contrast would be really black, really white. So if I'm looking for high contrast, like on a hand X-ray, I want to use low kVp high contrast. That's going to allow me to see the blacks and the whites, which would be all of the soft tissue in the area. When we get to the skull and we get to the abdomen, we want to see lots and lots of shades of gray. So there we want to use high kVp, low contrast, long and low, lots of shades of gray. Okay, so there are other things you think about with kVp, but the main thing, if you want to get it right on a test or on the registry, always think about contrast. So kVp is the quality of the beam. It is the potential difference between the X-ray cathode and anode. And its main factor that controls it is contrast. If we have low kVp, we have high contrast. And if we have high kVp, we have low contrast, long and low. Okay. All right, that's kVp. So the other thing that's coming out of this tube is amperage. Okay, it's coming out of your machine is amperage. Going into your transformers, amperage goes to milliamps. Whenever you think of MA, I want you to think of the quantity of the beam. Milliamps is the quantity of the beam. And that has to do with what's going on in the X-ray tube cathode. X-ray tube cathode, there are two filaments. There's a small filament and a large filament. So when you're selecting MA, you're either going to select small MA or large MA. Now, I like to make life easy on myself because I'm not real good at math and thinking in those terms. So what I've decided to do for myself is whenever I'm X-raying an extremity, I'm going to use small MA. And whenever I'm X-raying a spine or a skull, anything in the axial skeleton, I'm going to use large MA. The reason we use small MA is for detail. And actually, when I'm running quality control on my machines for mammography, I can tell that there's detail there with that small focal filament. And we want to use the large anytime that there is a potential for motion. And think about it, you have visceral motion. So if a patient's just laying there trying to hold their breath, their heart's still beating, their GI system is still working. So use that large MA spot whenever you want to have the potential to decrease motion. Okay, so small MA, large MA. Life is easy for me. So what I also like to do with the KVP is I like to select a KVP and stick with it. So let's say that my people that put together my room, they say to me, you know what, whenever you x-ray extremities, I want you to use 50 KVP. I'm like, cool, 50 KVP for all my extremities. I'm good with that. And then I say, okay, if I can only select 50 KVP, then I'm going to pick 100 MA. 100 MA small. And all of my extremities are going to be 100 MA small. And then if I'm x-raying the axial skeleton, and my people that provide me with my equipment say, you know what, go ahead and use 80 KVP with our machine when you're doing your lumbars, your abdomens, your skulls. Fine, I'm going to pick that. And then for my MA, I'm going to go ahead and pick 400 MA large. And then that's all I have to do for all of my exams. The only thing I haven't talked about is time in milliseconds, and that's where the math comes in, and I don't want to deal with math. So let's go back to MA for a second. So with MA, if I'm picking the small focal filament, I am looking at the number of electrons that are coming off of that small filament, which is on the cathode side of the tube. The cathode is the positive side of the tube. I actually had to ask Google because I always forget that. I never remember which is positive or negative. That's why I have Google over here and I can ask Google. So when I'm using the small focal filament, I'm going to have X amount of electrons coming off of that filament. And I think of that filament as like the light that's in your bathroom, that night light. It's kind of like that filament. Think about dust on that filament. That's like electrons. If I'm using the large filament, then I'm selecting a different filament, which is the large filament, which gives me the potential to not have motion on my image. Okay. All I have to do now is I've got to figure out my time in milliseconds. So my time in milliseconds is going to give me something called MAS, milliamps per second. Now, when I'm selecting MAS, I think of my perfect size patient. Well, a perfect size patient for me is going to be different than you, but I think about an average patient that should walk into my department. So I'm going to pick like a 200-pounder. And it's kind of like that I'm working at Cedar Point and I'm guessing people's weights. Or when I'm in the OR, I have to ask because that patient's covered up. Actually, there is a way that you can determine that to change from pounds to kilograms, but my mind can't do math that quickly. So if I walk in the OR and I say to the anesthesia, if I say, how many kilos is this patient? They'll say that the patient is 100 kilos. I'm like, oh, okay, about 200 pounds. I know it's not precise, but if I double it, I'm within the ballpark. So I'm like, oh, okay, 100-kilo patient is about 200 pounds. And I know what a 200-pounder looks like. And so then I have to select radiographic technique. So when I'm selecting technique, let's say that I'm doing a hand x-ray on this patient. I will select 50 KVP, 100 MAS, and then 100 MA. And then I will try to figure out the MAS to get me an x-ray that is within the parameters of the machine. So if I have a DI that I need to look at, or if I have an EI number, an S number, I try to get within those parameters. So let's say that this 200-pound person, I shoot a hand x-ray and it's 50 KVP, 100 MA at 1 MAS. Then what I would do is I go from the hand up the arm. I'm going to progressively increase my MAS as I'm going up the arm. Because remember, when you increase the size in centimeters, you're going to have more MAS. So if I go 50 KVP at 1 MAS, I can go 50 KVP at 1.5 MAS, 50 KVP at 2 MAS, 50 KVP at 2.5 MAS, 50 KVP at 3 MAS. Just go up a half a step in MAS as you go up the arm. And that works really well for upper extremities. So I go around the entire state of Ohio and I teach people how to use x-ray machines. If they don't know techniques, I have a hand phantom that I bring with me, and I shoot the hand phantom and I try to get that technique where it needs to be with the EI numbers, the S numbers, and the DI numbers. And then I can figure out the radiographic technique from there. That's kind of what you're going to have to do when you go to a different place other than where you're a student. But just start to think about this. So like when I was a student like you, I would go to take an abdomen x-ray, and let's say that we are on AEC. I would look at the patient and I would say, you know what, if you're my patient and I'm x-raying your abdomen, I'm thinking that you're going to have an MAS about 40 MAS. And then I go ahead and I take the picture and I see if I'm right. If I'm right, then I'm like, oh, good. I know how to select MAS on a patient. And then I go from there. That's how you're going to have to learn MAS, is just actually trial and error. You know, I don't want you overexposing these patients. I don't want you underexposing these patients. But if you're on AEC, the automated exposure control, it's good for you to say in your head, okay, I'm going to x-ray this chest. I'm going to use 110 kVp, 400 MA. I think my MAS is going to be about 2. And then you push the button and you see how close you are. That's how you learn technique, okay? So what happens when you take an x-ray is the electrons are going to leave the cathode. They're going to go over toward the x-ray tube anode, which is going to be spinning. And then the electrons are going to come out of the tube as photons of X radiation. Now, if I was x-raying this patient and I was giving them 80 kVp, 40 MAS, I can expect 80 kVp toward the cathode side. As I start to go toward the anode side, the amount of radiation coming out of the tube is going to become progressively smaller. And that's called the anode heel effect. With the anode heel effect, the intensity of X-ray is going to be greater on the cathode side versus the anode side. That's why we put the fat side of the patient, their big belly, underneath the X-ray tube cathode. Now, remember that when you're X-raying a foot, because if I had a foot up here, I would want to put the toes toward the anode and the heel toward the cathode. So that's something you need to remember too. So the only thing I really need to look at is time in milliseconds. And thankfully, you're not doing fractions like we had to do, because we had to go in and we had to say if we were taking a 10th of a second exposure, a 20th of a second exposure, a 25th of a second exposure. And we actually had to do that math every day in our head. Thankfully, you don't have to do that. Most of your machines are going to do that for you. So that's really nice. The other thing I think about when I have a patient is, am I going to be taking an X-ray at 40 inches or at 72 inches? In my hospital where I work right now, we're taking chest X-rays at 72 inches and we're doing everything out. Well, chest X-rays and cross-fire cervical spine laterals are all at 72. Everything else is at 40, unless you have a sternum or something like that. So those are all the things you need to think about when you take an X-ray. And I hope this was helpful for you. And later on this month, I'm going to try to put together some films for you to show you the difference between the contrast. Oh, one more thing. I am so sorry. When you were thinking of X-ray tube and you're looking at MA, anytime you think about MA, you do want to think about quantity, but you also want to think about density. Is the X-ray, if it's a film, is it black or white? Okay. Is it darker or lighter? And that's really hard for you guys to understand because you're not seeing it on your images, because your images are all digital. So I will try to help you with that. I'll try to show you some images. But remember, KVP, contrast, MA is density, and you will go far in the world. All right. Have a good day. Take care, guys. Bye-bye.